Hello everyone, I am Dr. Avinash Chaitanya. I am a surgical oncologist at Care Hospitals, Gachibowli. I deal with head and neck cancers. So today I am going to tell you about how I evaluate any thyroid swelling. So when a patient comes to me with a thyroid swelling, the first thing that we need to see is whether the thyroid gland is functioning properly or not. Apart from that, if there is any swelling, we need to characterize the swelling, whether it is benign or malignant. So for these reasons, we need to do a few tests. The first test that is generally done is a thyroid function test and an ultrasound of the neck. So with this, we get a general idea about the functioning of the thyroid gland, whether it is hypofunctioning or hyperfunctioning, and also we'll get to know the type of swelling that is present in the neck. So sometimes there is a midline swelling and it is not a thyroid gland in itself. So to rule out all that, an ultrasound scan will tell us whether there is a nodule in the thyroid, the size of the nodule, the characters of the nodule, whether it is a cystic swelling or whether it is a solid swelling, because solid swellings are more likely to be malignant. Apart from all this, we will get to know if there is any, apart from the thyroid swelling, if there is any all other nodes in the neck. By all this, we get a rough picture about what's happening in the neck. Apart from this, we get a ultrasound guided FNAC, that is a fine needle aspiration cytology, in which we put a needle in the thyroid swelling, aspirate it, and those cells which are aspirated are checked by the pathologist, and we come to a diagnosis of what is wrong with the thyroid gland. So these guide us towards what treatment we need to do. So FNAC test is reported as Bethesda 1 to 6. So in Bethesda 1, it is an inadequate smear and we generally repeat the FNAC after 2 weeks. Bethesda 2 is supposed to be a benign category. So it is proven that it is benign. There is no atypical cells seen. So in that case, the only reason for us to operate or intervene for such patients is whether it is cosmetically looking bad or if there is any compressive symptoms like difficulty in swallowing, difficulty in breathing or change in voice which is causing the issue, or if there is a retrosternal extension and causing trouble with the breathing and other stuff. This is Bethesda 1 and 2. Now comes Bethesda 5 and 6. So Bethesda 6 is a sure shot malignancy and there is no other option but to operate. Bethesda 5 is almost like Bethesda 6. You know it is cancer, but you want to still consider other options, saying there is cancer of in the gland, but it might not be arising from the thyroid. I have a patient who was operated as a Bethesda 5 thinking it's a papillary cancer, but it turned out to be a lymphoma. So Bethesda 5 will give you a possibility of malignancy, but not sure whether it is from the thyroid gland or not. The Bethesda 3 and 4, they are doubtful. That is, their atypical cells are present, but it's not sure whether it is a malignancy or not. Sometimes it can be a malignancy of a follicular variant that is arising from the thyroid gland. Sometimes it might not be. But in those cases, the option would be to do a surgery, wait for the report, final histopathology report, and decide whether we need to remove the other gland also if it turns out to be malignancy. So this is the initial evaluation of any thyroid swelling. We don't do any PET scans. We generally avoid CT scans, and ultrasound scan, the age-old test, is one of the best in evaluating a thyroid nodule along with an FNAC test. Thank you so much.